If you have shoulder pain and you don't know about the rotator cuff, I'm sorry to say it's going to be very difficult for you to recover. Deep muscles, supraspinatus, infraspinatus, teres, and also the subscapularis. These are the muscles that provide stability to our shoulder joint and allow us to be pain-free. And today I'm going to teach you how to work them. We're going to look at 3 exercises with different variations, where we'll start with the simplest to the most difficult in a very progressive way. So you can find the exercise that works for you, strengthen your rotator cuff, and make shoulder pain just a memory in a few months. To do these exercises, you'll only need a water bottle that you can fill as you like, depending on whether you want more or less resistance. And a bed, a sofa, something you can lie down on to do the exercises. Let's get started then. First exercise, I sit properly, upright. The position of your back is very important for shoulder health, so always sit up straight. We'll start working on rotation, which is essential for the rotator cuff. Let me remind you, this is the simplest of all. I want you to place your arm really, really close to your ribs. If this causes pain, you can place a small towel. And from here, I want you to bring that fist inward as much as possible without letting your elbow come off. This, for example, is incorrect because there's a lot of separation here. This, for example, is correct because there is no separation. And I'm bringing that hand inward. Next, we're going to do the opposite movement. I'm going to bring that hand outward as much as you can. Again, we try to isolate the movement of the shoulder. I could take it much further back if I move my spine with it, but I want the mobility to stay only here. Pay close attention. The elbow stays down and my spine stays still. I'm completely fixed, anchored, straight, and the work happens inside my shoulder. It might cause a little discomfort. That's not unusual, but it shouldn't be very, very painful. The simplest level, here, gravity comes from top to bottom, and it doesn't pose an extreme difficulty. If it's too easy, I encourage you to try holding a small bottle in your hand and do 10 repetitions with me. To complete the first set of this exercise, internal rotation, external rotation, as far out as you can without rotating your back. Internal rotation, external rotation. Very good. The heavier the bottle, the harder the exercise. Very good. 4. External rotation. Arruinaggio. 5. External rotation. Here I do it right, here I do it wrong. Here I do it wrong when it lifts off, here I do it right. 7, last 3. We're only going to do 10 just to notice the sensations. 8. 9. Last repetition. And we put down the bottle. You might notice some fatigue, even though it's a simple exercise. What you shouldn't feel is pain. That means we either need to remove the bottle or do fewer repetitions. This is level 1. With your elbow kept close to your ribs, your shoulder works safely. Let's lie down on our side to do the same level 1, but with slightly more difficulty. So lie down on your right side and rest your head on your left hand. Personally, I like to get close to the edge of the couch, so that the bottle isn't resting on it, but is practically in the air. And keep a constant tension in the rotator cuff like this. Keep your elbow well anchored here at your waist, just like we've done before. If it bothers you, place a small towel between your ribs and elbow. From there, it's essentially the same movement. Move outward to the max, rotate, hold for 3, then relax inward. Keep your elbow down as you return. Don't do this, but always keep contact between your ribs and your elbow. We do 10 repetitions, external rotation to the maximum. Look how nice. 90 degrees of elbow flexion, relax. And I return to the original position. 2, touch down, and again we go up. 3, just like this. The bottle touches. Let's go again. 4. Hold the contraction at the top for 3 seconds. Again, 5. I'm sure by the 5th one you'll start to feel some contraction in the rotator cuff area. Clench your teeth, strong contraction. 6, we have 4 left. And as you can see, the sensations change greatly depending on your body position. 7, we have 3 left. Up all the way to vertical, 8. And this basically happens because of gravity, depending on your body's position. 9, last repetition, we go down, touch up, and 10. Very good. Once we finish that exercise lying on our side, we've already completed the first difficulty of the first level of rotation in the rotator magnet. Now let's move on to the second level. Notice that earlier I told you that if the elbow is close to the ribs, the man is protected. Now we're going to move it away a little. How? By bringing that arm to 90 degrees of flexion. Before I had it here, now I have it here. Wider distance between the rib cage and elbow makes the exercise significantly harder. Let's try it without any weight instead of the bottle. I prefer starting without weight to feel the sensations. I want you to place that arm just like I showed you. Here, a right angle. Here, a right angle. And from here, we're going to act as if we had a little stick. Here, a rigid rod. Imagine that rod and let that arm fall inward. Okay, we try to keep this very straight. The arm area, and then tilting outward, we let it drop. The movement is very controlled, very smooth, very gradual, never below horizontal. In fact, I doubt you'll go much lower. And then vertical, and we try to go out a little bit to the side. Be careful not to, see, look. And again, as we thought, with the spine nice and straight, nice and upright, my torso doesn't move at all. Horizontal. Vertical, okay? And after trying 3 or 4 repetitions, can we feel any sensation of work in here? What I'm gonna do is add weight. If you don't think you can move the weight, then don't use it, okay? Join me for 10 repetitions without any weight. Arm at 90 as we said, elbow at 90. I let that bottle drop inward, down to horizontal. I lift that bottle outward and take it a little further, just a little, that's all. I let it drop. That's 1, inward, no lower than horizontal. There, I made a mistake, outward. 2. If the bottle's too heavy, remove some water. If it's still heavy when empty, take out the bottle. 3. Relax. Horizontal and up. 4. If you see that by the 5th one, you already, feel discomfort. I'm feeling fatigue already. 5, but I have to finish the set. Well, then you stop at the 5th one. It's okay. You're not less for doing it. Finding that working point that works for you. 6 is ideal. Doing less doesn't mean you'll recover less. On the contrary, if your body is complaining at 7, it's because you're already overdoing it. It can't handle more shoulder work. 8, I have 2 left. 9, last repetition. And 10. There, I went a little lower than horizontal. Very good, good job. Let's move those shoulders a bit. At the end, I'll show you an exercise to relax your joint capsule and keep your shoulder healthy after these exercises. This is a variation. If it's too difficult, we have another option where we just position ourselves. Sitting with the knee bent, we rest the elbow and work it here, but it's much easier. I don't like it much because the shoulder doesn't support your arm, it just rests on the knee. But if you're in a lot of pain, well, then it's worth doing it. Especially if the first level I showed you doesn't work very well for you or you don't feel any kind of effort. Great! This is the second level, but there are many variations. I just showed you another. Let's do 10 more repetitions lying down so you can see exactly how it's done with a little more intensity. Let's lie down. You already know we're fighting against gravity. In this case, we're going to need a pillow because in your right hand, it has another function. Pay close attention. I place my head comfortably on a cushion. And from here, what I'm going to do is place my arm in the same position as before, okay? That is, we started in this position and I'm going to use my opposite hand to give it a slight support. Okay, so it can rest and the exercise is a little easier because honestly, it's very challenging. From here, it's the same movement. I let my bottle drop until it's vertical, even until it touches the couch. And the interesting part is this, okay? I pull outward, 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 and as far as you can, as far outward as you can. I let it drop very slowly. We never let it drop straight down. And then up very slowly. Until the maximum external rotation. 2, I relax. Up, up. 3, come on, let's do 10 together. I relax up. 4. I'm going to add garlic. and up. Zingo. I'll leave it. And up. 6. And up. 7. And what can we do? If it's simple and we have a steel shoulder, we just remove the hand and attempt the movement freely. Let's leave it here so it doesn't get in the way. Move the arm along its axis, but be careful, it's hard to keep it stable, so this part of the arm may move. And so we can reach this far. 8, just 2 more. Pretty tough, not for everyone. Let's go up, that's it. Clenching your teeth. 9, last repetition. Oop, 40, 40, 40, 40, 40, 40, 40, 40. That's it, but we don't give up. Even tired, we descend slowly. Wow. Impressive work, huh? Be careful about stopping support for that arm, because the exercise can be extremely intense. Alright, we've already seen both levels, with 2 variations. Well, in the second one, I showed you a third one, sitting here on the couch. Now let's move on to the last exercise, the one that challenges our damn rotator the most. And you need to keep something in mind. I previously said that keeping the elbow near the rib cage made it easy. Putting it here makes it harder and less stable. The last level is moving that shoulder outward. This way, what we do is really put the shoulder muscles under tension and therefore is much more challenging. It's the same movement, it may surprise you, but it's basically identical. We'll let that arm drop to horizontal. It doesn't need to go lower, as that could cause pain. And then we lift it up against gravity. Slowly up to vertical. Remember to stay very upright, because when you're here, like this, doing the movement, it causes more pinching in the shoulder, and it's much worse. Let's do 5 reps without weight since it's tough, then 5 with weight. After that, I'll show you a lying down variation. Thoughts? Impressive, right? Very good. I stand up straight, fist forward. I'm going to turn that palm up and all the way. See how good my form is. 90 degrees here and here. This is the final position we should all aim for. I drop down until I'm horizontal, and from here we go back up to vertical again. 2. Where will we feel it? Vague, in the rotator cuff or shoulder. It's not an exercise where you say, wow, it hurts here. It's more diffuse work, since the shoulder has many muscles. 3 or 2, let's do 2 more. 4, very good. Last rep, up. That's 5. Was that easy? Well, let's grab the weight here. He's checking to make sure we're recording, because sometimes it happens that I think I'm recording, but it's actually not recording. We grab that bottle, hold it horizontally, and up. Strong, strong, strong. Just like that, as if you wanted to pour a little water on your head. Whew, I did one and my shoulder already feels like it'll explode. 2, great. Let's try for 5. 3, come on, last 2. 4, last repetition. Let's go up. Come on, come on, come on, come on, come on. And 5, very good. Phew. Let's relax that shoulder. Intense work, but that's not all. There's one last variation of this third level, with the arm further apart, which will challenge your shoulder's health even more. And we're going to do it here, live with you. We lie face down. We leave the bottle near the edge of the bed or the couch, because we're going to need it. We lie face down and rest our chest on the couch. The trick is to keep your arm on the outside. Look closely. I can leave my arm on the outside, or I can leave my arm on the inside if my chest is resting more toward the inside. What I want is for the chest to be right at the edge. We're going to challenge that shoulder with the hardest variation, so we want it to be really tough. My chest, my rib cage is here, right at the edge of the couch, and the arm is completely outside. That's important, because otherwise I'd have a lot of support from the couch. From here, well, let's leave the bottle aside for a moment. I want you to place that arm in the same position as before, 90-90. Remember, we're going to maximize that external rotation, resisting gravity. Wow, this is really tough here. Hold for a couple of seconds and then let it drop. 1. I'm going to slide over so you can see it better. Arm in starting position and outwards. Strong, 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 strong. Very good. 2. Here we keep the chest limited and anchored. The movement happens only in your shoulder. There's nothing from the spine. Very good. 3, last 2, and we add weight, vertical, and I go up 4. And if you think about it, it's really the same movement I did when I was sitting. That's 5, but a little bit harder, because when you change your body, gravity also changes. It's stronger now. Good. Let's get in position with the bottle for the last 5. Same position. Arm vertical, and I lift it up until it's horizontal, as far as you can go. That's it. 6. Come on, just 4 more to go. 7. Very good. 8. Hey, Marco Sacristan, last 2. 9. Ugh, last rep. And done. Very, very good. Relax and breathe. Did you truly earn it? It's just an exercise. That's very complex. I'm not sure many of you can do it. For me, it's been quite a challenge. Let's sit down so I can explain how the dosing works, and the last exercise I still need to explain to you. Also, to relax that muscle and the shoulder joint, the Cotman exercise. It's an exercise that aims to grab the humerus, the arm, to its joint with the scapula, which is the shoulder joint. Obviously, to relax all that deep musculature that we have. And it's very pleasant, very effective, number 1 for relieving discomfort or for post-exercise. For that, pay close attention. I want you to follow me, okay? 1 foot is on the floor, not sure if you can see it. Place the other hand at couch level, letting your arm hang straight down. Watch your back, don't hunch over. Push your butt out slightly and stay straight. I want you to make circular movements with that bottle outward. Very pendular, very calm, very controlled, This will allow the muscles to gradually relax and the humerus to gradually pull on the scapula. I suggest using a medium, considerable weight, okay? Maybe 2 liters. That would even be low. You could use a 5-liter jug to make it really effective. Close your eyes, breathe, try to relax your shoulder, and feel how that shoulder is being pulled down by the weight. 1 minute on one side, and then we switch to the other side for another minute. The more weight, the better. The more concentration, the better. And the greater the coaptation. There's no secret. It's about strengthening the cuff and then rewarding it to relax. Smooth rhythm too. It doesn't need to be fast, just comfortable and pleasant. How do we work on this? We've seen many exercises, so just try them all. At first they'll be easy, but in the end they're going to be very difficult. Well, then stick with a level of difficulty where you say, this is hard, but it doesn't cause too much discomfort. That's really the trick you have to do for your shoulder to get better, to stimulate your shoulder within its capabilities. On one hand, it provides enough stimulus for adaptation and strength gains. On the other, it doesn't. Don't overstimulate, push too hard, or cause pain. That's the secret. After learning the exercise, repeat it for 4 sets of 10 reps as I mentioned. We have done 1 set of 10 of each exercise. You do 1 set, rest for a minute, do another set of 10, rest another minute, and so on, 3rd and 4th. That's it, it's not hard. If you do it on high days, your shoulder will be like steel. A month from now, you only have the hardest part left, which is being consistent with the exercises. If you enjoy my videos and content, subscribe to my newsletter to stay updated. A card will pop up for you to click, enter your email, and you're in. Every Sunday, I send an email with the videos I've recorded during the week. It's the best way to not miss anything at all. That's all. I sincerely thank you from the bottom of my heart for staying with me until the end of the video. I hope you're aware of the importance of consistency and that you can share this with anyone who has shoulder pain. See you very soon in one of my other videos. Bye, friends.